Brace yourselves. Oh! Oh! What's up, guys? Today we're going to be playing Surgery Squad again. So let's get right into it. We're going to be pulling wisdom teeth. This should be fun. Memories are already starting to come back. I got mine out when I was 18. Have you had yours removed yet?
A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars, commonly known as wisdom teeth.
It's very wise.
Most of us have to have our wisdom teeth removed due to chronic pain or discomfort,
no, it wasn't
periodontal disease,
nope,
or an increased risk of damage to the adjacent teeth.
You know, they removed my teeth mainly because one might have caused damage to the other teeth. As
a preventative measure, even
but the doctor was like, "Hey, let's have at it and remove all four." It's only $1,500.
Wisdom tooth removed.
Thank God my dad has insurance.
May refer to it as tooth number 32. Before we begin, let's get some X-rays taken of our patient's teeth. X-rays or let's get started. First, insert a positioner into the patient's mouth.
All right, that's not too bad. Let's just set it right there.
Next,
keep your mouth
position
open.
The X-ray cylinder where indicated.
Hello, lady. Okay, we need to take an X-ray first. Let's just put it right on our cheek. Perfect.
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to.
Oh, that's a good idea.
Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure.
Yeah, but are you going to put the apron over her face?
I couldn't have done it better myself. I'll have my assistant finish up the rest of the X-rays, and then
I actually didn't do anything. Images. But thanks.
Well, everything appears to be normal with the wisdom tooth's roots. And now that all of the X-rays have been completed, we can extract our patient's wisdom tooth.
Why are we taking your wisdom teeth out, though?
The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth.
Erupted.
Patients that have 2 or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic.
Nice.
When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic.
Oh, that's boring.
You'll need to apply a topical
so she actually
numbing
gets to watch
me
while I do this.
Injection site. This will help decrease any pain the needle may cause.
Let's just make sure everything's clean. Clean as a whistle here. Perfect.
Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
Yep, I know what that's like. They do this a lot with teeth, it seems. They really like to stick things in your gums. But I guess the gums are the closest thing to where your teeth are. True story. Your gums are near your teeth.
Truth!
Yeah.
And now we'll give our patient a few minutes to become completely numb.
Yeah, waiting.
Great. The patient's mouth is numb.
Fantastic.
And now we can move on to removing the wisdom tooth.
Let's get to it.
First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
Wiggle, wiggle, wiggle. Wiggle, wiggle, wiggle.
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
I'm not gonna throw up. If I puke on my mic and my keyboard, that would not be ideal. I don't do well with this sort of thing, though. It's dentistry, dental surgery. Why didn't I pick the colonoscopy? Colonoscopy would have been so much easier to do. All you have to do is just stick a camera up a guy's anus. This is much more intrusive. That's right, I said it. This is much more intrusive than sticking a camera up a man's anus. All right, let's just brace yourselves. Oh! Oh,
Now clean the area using a surgical suction. This will allow us to check the area for any bony matter.
Quick, get rid of all that blood. McDonald's straw. Delicious. And let's just rinse it out. Oh, that feels nice. Oh, that feels nice. Let's suck some more. God. Alright, that's
Everything looks
perfect.
great, but we're not done yet. Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a
Oh God,
clot.
it's bleeding. Oh God, it's bleeding. Stop the bleeding. There. Now go home and eat some Doritos.
Since the patient is clotting properly,
No,
we can go
we're not
ahead
done with
and
you
place
yet.
some fresh gauze in their mouth.
I want to take this one out next. Let's take another one out. That was fun.
When getting wisdom teeth removed, it's important
But
to
I think we're
remember
wrapping
that
up here.
everyone recovers at different speeds.
This doctor's
The
talking
rate of your
again.
recovery depends on a number of factors, including the complexity of the extraction, your age, and
He's
your
very well
individual
spoken
recovery
for a
capacity.
fictional doctor.
Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon
That's what my parents had me do. I wanted to do it on a Monday so I could miss days of school, but no, I had to do it on a Friday, so I spent the whole weekend just like sitting around drinking juice. Although I did get to spend most of it on the computer, I will admit that. That was pretty great.
And gently rinsing your mouth out with warm salt water to help relieve pain.
I did make the mistake of eating potato chips though on my second day of recovery, and that was a lot of pain in my gums.
But it will also reduce
But the chips tasted good,
and could
so
introduce germs and contaminants to the surgery area.
you know,
And
take what you can
that's
get,
a
right?
wisdom tooth extraction. You did great. If you're up
We
to
did
it,
great,
why not
guys.
try another
Good
procedure
job.
on surgerysquad.com.
If you enjoyed this surgery, make sure to leave a thumbs up and let me know why or why not you liked it in the comments below. If you'd like to see me do another surgery squad, please leave a comment requesting which one. Could it be breast implants, natural childbirth, double mastectomy surgery? That would be fun. If you haven't already, be sure to subscribe and definitely check out my channel. I come out with regular content every other day. In the meantime, I will see you guys in the next video, and stay frosty.
I don't want to do it. I don't want to do it. I'm doing this for you guys.
What's your position?